the patron for Red Cross is the president of the country. So it's not like the usual NGO, because you are created by the government, you are part of the government, but you are supporting. You are an NGO but supporting the government.
How are we defining or redefining IFRC's identity or perception, public perception, as an emerging key player in public health landscape?
Welcome to another insightful episode of Paul Talk Science, where we explore cutting-edge developments in global health and innovation. I'm your host, Paul Adepoju, and today we are diving into the critical role that organizations like the International Federation of Red Cross and Red Crescent Societies, IFRC, play in public health emergencies, with a special focus on Africa. In this episode, I sit down with Paul Cheruiyot, Head of Programs at IFRC, to unpack how they've been navigating the complex landscape of health crisis, from COVID-19 to newer challenges like Monkeypox. We will explore their partnerships in Africa, notably with the African Center for Disease Control and Prevention and the MasterCard Foundation, and how they've mobilized millions across the continent in vaccine demand creation, risk communication, and community health workforce development. Stay tuned as we break down how IFRC's approach is reshaping public health response, not only in times of war, but also in peacetime, focusing on community engagement and emergency preparedness. Let's get started.
It's okay. Yeah.
Okay, so what is it? I think you're based in Kenya, right? If I'm right.
No, I am based in Ethiopia. I'm in Addis.
Wow. Have you always been in Addis, or you had to move to Addis because of the role?
No, yeah, I've been here this is my second year, almost 2 years now, because I came in the end of 2022. So I've been here, so end of 2022, 23, 24, I'm still here, up to next year. Then I can go back to Kenya.
You're originally from Kenya, right? Which part of Kenya?
Yes, I'm from Kenya, Rift Valley. Yes, not far from Nakuru.
I think Rift Valley is also very popular in public health, if I'm very correct, right? Hello?
Yes.
Yes, okay. Thank you so much.
I can hear you.
Okay. So, one of the things that I said, I have to reach out and have this conversation with you is, when we talk about the Red Cross, we really ideally talk about Red Cross from the perspective of vaccine. Ideally, I know there are remote connections that we can see, especially when there are crises in crisis regions. But let's talk about the way IFRC is set up and what the COVID experience was for IFRC, especially in Africa. So that's a point I would like us to start from.
Yeah, thank you. I think for IFRC, we are just a secretariat that is to Red Cross and Red Crescent movement. So IFRC is just secretariat and membership organization. And how we respond in terms of majorly pandemic, because that is our major work in terms of emergency, whether there is any man-made calamities or maybe natural calamities or diseases. That is where we come in. And IFRC and the Red Cross and Red Crescent, they play an auxiliary role to the government. So we are just auxiliary to the government, just supporting them, because how we are structured is we are not the usual NGO. We are made by the Act of Parliament, that is from one country to another. So we play auxiliary role, just supporting the government. Now, coming to COVID-19, how we are structured is IFRC was majorly in charge of resource mobilization and technical support to the Red Cross and Red Crescent movement. So IFRC normally launches an appeal just for money for response, and then design the programs which will be supporting, that is being implemented by the national societies of the Red Cross and Red Crescent movement, while backstopping in terms of in terms of implementation. So technical support to the rollout, to in terms of response, and in terms of reporting and donor compliance. So that's where IFRC come in. And but the actual work of response is normally our principle. It is the role of the national societies just to respond, but we are backstopping. So in COVID-19, we had two processes which were ongoing. One of them is we had the emergency appeal, which was running from country to country. So where mobilizing resources to the national societies to do the implementation. While at the same time, we had a program called Saving Lives and Livelihoods, which also a continental program, which we have been implementing with African CDC, funded fully by MasterCard Foundation. And also in year one, it means we were looking at 29 countries where we were implementing, and IFRC was majorly focusing on demand creation, so creating the demand for the vaccine, as well as also addressing any rumors which are emerging from vaccine uptake. So that was the major role, and as well as also capacity building, because preparing the continent for the next pandemic. So at least also capacity building was a very key component, strengthening the capacities of the ministries of health. Thank you.
Okay, so you've mentioned a lot of, I think you've used it, let me put it this way, you used a lot of diplomatic textbook words, due process terminologies that I would want to unpack and look at what it looks like for a typical African. So if we can how why these IFRC's intervention looked like that made a lot of difference that we may have been unable to pull off if IFRC wasn't on board. So let's be that case more clear.
Now, when we talk about auxiliary, it means we are playing supportive, you can call it supportive role to the ministry, because Red Cross and Red Crescent, their work is to support the ministries of health. So that's why it is created by the Act of Parliament. So they support the ministries of health, and then you find also in terms of management, even the patron for Red Cross is the president of the country. So it's not like the usual NGO, because you are created by the government, you are part of the government, but you are supporting. You are an NGO, but supporting the government in terms of any emergency response. Now, in terms of actual, what did IFRC do specifically? One of them I have said is in terms of resource mobilization, which means program design. So it means, let's say we pick we can pick, okay, let's say COVID-19. Okay, here it has been declared by WHO, there is a pandemic. So IFRC comes in and see, how are we going to intervene in terms of the response? So in terms of the design of the program, and then after the design, it means, how are we going to resource the program? And then now implementation. So implementation is not us, it is through the Red Cross. So it means now bringing on board the Red Cross in terms of the design, country to country to country. So that is the major role of the IFRC in terms of design of the program and the resourcing, as well as ensuring the rollout. So backstopping of the national societies is their major role.
Yeah, thank you so much. So let's look at IFRC's role now in the current public health landscape, especially in Africa. For me, when I was thinking about all of this, I told myself, I may be wrong, but probably responding to public health in a non-crisis, let's say, we know Red Cross to go in during wars, those kinds of scenarios. But we are looking at a public health emergency, especially in regions where there are no wars that are ongoing. So how are we defining or redefining IFRC's identity or perception, public perception, as an emerging key player in public health landscape?
Now, thank you. Maybe just a correction for IFRC. Okay, we are two partners. There is also what we call ICRC. ICRC is the one who respond in war. So, like what's happening in Syria, Palestine, in Sudan. So, in terms of war, it means ICRC coming. In terms of humanitarian assistance, that is now IFRC coming. But we are just one entity. So internally we are divided. So you'll be having IFRC, ICRC. Now, what is the role of, because we don't play only emergency response in crisis. I know that's what we are known. We are known because when there is an emergency, you find Red Cross, Red Crescent are there. So that means also the public, they know that's where we work on. But there are some other interventions which we are working on, which are not related to crisis. And one of them is that, for example, in terms of mental health, I think that is a great area, psychosocial support, where IFRC and the national societies are playing a greater role. And also in terms of preparedness, that just for any health emergencies, it means that, for example, wash, sanitation, that is also an area where we are very active in terms of preparing in the communities where we are working. So you will find it's not only in the emergency response, although, okay, in wash, sometimes it's a thin line because, like for example, what happened in Malawi. So it's a wash, which means also we need to come in now and support. But there are some also, I think in Uganda, it's also like a crisis, and initially it was just a normal wash. So we work on prevention strategies. That is working with the communities, because most of us, we are just based in the community. Now, and so I think if you look at the IFRC, that is the role is just preparing, that is for emergency response, as well as also preparing the communities in case of any public health emergency. Thank you.
Yes, thank you very much. So let's talk about the involvement with the MasterCard, African CDC MasterCard Saving Lives and Livelihood Initiative. What can you tell me about how IFRC was brought on board? Why did you think IFRC was brought on board, and what was the experience like for IFRC?
Yes. Now, for engagement with MasterCard, okay. First of all, starting with African CDC, IFRC is having, we have a memorandum of understanding with African CDC. So this is a framework agreement where, in case of any emergencies, it means we can work together. So the agreement has been running even before the COVID-19. Now, when during the COVID-19, it means there was a declaration that is for looking for the partners by African CDC who can work together jointly in terms of continental response. And they put out the request for proposal, which was just for all the partners who are interested. IFRC positioned themselves on it was 8 pillars. So you are given 8 areas where you can pick. So we pick risk communication and community engagement, because that is where we have greater expertise. And so IFRC was brought on board after that review, validation by African CDC, and then now coming by due diligence by MasterCard Foundation, because MasterCard was the back donor, but most of the technical assessments were done by African CDC. Then when it came to financial compliance, and MasterCard came in terms of ensuring the partners are compliant. So IFRC was supposed to work in sub-Saharan Africa. So we were looking at the countries within the sub-Saharan Africa on we call it pillar number 3, risk communication and community engagement. But in the northern region, you find also it's under, we call it the MENA region. So there were no partner who was ready to take on the northern region. So IFRC also was given at the northern region, but our interest was the sub-Sahara. So for the northern MENA countries, because there was no other partner, and I think the partnership has gone on well because through the engagement and with MasterCard Foundation, we currently have 2 programs. One of them is the one we are talking about, saving lives and livelihood. There is another program on community and workforce. So community and workforce is we call it the CAW program. So also based on engagement under year 1 and 2 for the saving lives, we design another program which is currently on the rollout. So it's also targeting countries in Africa where the idea is to recruit and sustain and maintain 2 million CAWs in Africa. So that is a very ambitious program. We are not working alone because IFRC also is picking some, I think around 5 countries. UNICEF is picking other countries where they are also working. So that is the relationship we are having with MasterCard. Thank you.
Yes, thank you. I want you to take me to like the front line of IFRC, whether it's the Red Cross or Red Crescent members' involvement during that phase of response, especially in specific areas that you can mention, so that I can be able to paint a picture of what that looked like beyond the executive office, where people like you are making the decisions,
Yeah. No, in terms of so the IFRC majorly because we, after the design of the program, engagement agreements with MasterCard Foundation, African CDC, after signing the service agreement, it means now the next phase was in terms of response. And in terms of the response, it means IFRC, their key role was to mobilize the volunteers because that is the strength of Red Cross and Red Crescent movement. We are having a chain of volunteers from country to country. So for us, it means when we have signed the agreement, gotten the resources from MasterCard, it means rolling out in terms of activating now the volunteers from one country to another who can be in the front line because for us, we were creating the demand, just mobilizing people to take the vaccine. So you find market engagement, door-to-door mobilization is what the volunteers were doing. So, and the moment someone accepts to be vaccinated, we were working with UNICEF, not UNICEF, AMREF. Okay, AMREF in the eastern and southern, and then there is another organization who was working in the central and western. So working together, for us, we create demand, we convince people, we address the needs. When someone accepts to be vaccinated, that person is shifted to AMREF to provide the vaccine. So we were working together. For us, we just create demand. When we go to that, for example, you go to a marketplace. We're having public addresses, they're mobilizing people who have accepted to be vaccinated, they go to attend where AMREF is there. Then they can provide, they can get the vaccine. Then after vaccination also, it means we need also to address the myths which are rumors, which are emerging. So that is the work of IFRC. So we mobilize, that is in the forefront, because we say out of the countries we were engaging, we reach around 256 million people. Those are the people we reach in Africa. And out of those 56 million, that is were vaccinated. So our role was just creating the demand. And then after creating the demand, AMREF administers the vaccine. And for us, we were using majorly the volunteers in terms of the fourth.
Yes, thank you very much. So what insight do you think IFRC got from its involvement in this very, very important phase in global health that could further define how it engages in health issues on the continent? So what were the insights for IFRC stemming from what was done during the COVID?
Yeah, I think the insight was, first of all, role of the Ministry of Health MOH is very critical in terms of emergency response. I think that was one thing which came out very clearly, because, for example, you go to, let's say Namibia. I can pick Namibia, for example. So you are ready to roll out mobilization and engagement, but you find the ministry is not on board in terms of you need the approval from the ministry, which, the bureaucracy, it takes time. And this is an emergency response. So, and it's not only Namibia. Most of the countries' bureaucracy was the big challenge for us, and which delays in terms of the response. And then also any continental engagement. Remember, we are working with the partners. We are not alone. Like for us, we are working with AMREF. So AMREF has its own way of working and policies guiding deployments. And while us also we have different. So you find there is having that connectedness between the two partners, and we were around 7-8 pillars. So having different partners working together, it was just a challenge, because it delayed the process. So you end up implementing like the normal program, while this one was supposed to be a pandemic response. So having an agile system for coordination continentally will be key, and we expected CDC to be the one coordinating and doing that. Then also what we learn is in terms of capacities, especially at the district level within the government. I think the capacities from country to country is very low, which was a big challenge, especially for us, risk communication and community engagement. So it was very low. So what we are doing even now under phase 2 is skills transfer, building the capacities, especially at the district level, so that they are the one who can address all these issues. And then for the community mobilization, I think it's a very key area of strengthening, so that if we have community linkages, and it makes it easier, because for us, using the community structures was the one which allows us to do a lot of mobilization. So maintaining that community engagement, especially through the leaders in the community youth networks, it makes it easier for us in entry in case of another pandemic.
Yes, talking of another pandemic, Mpox, everybody's talking about Mpox right now. And I think the partners that you worked with during the COVID are also the ones that are actively involved in coordinating and championing and bringing attention to Mpox. And there is also roles for risk communication and community sensitization. So what is IFRC doing?
Now, last year we were talking about preparing the continent for the next pandemic. And through engagement, we were thinking the next pandemic is around 10 years down the line. Then we respond. But here we are with the Mpox. So also IFRC has also repositioned itself in terms of the response. And currently we are having also joint response together with WHO and African CDC, where we have also developed a program, which was, I think it's around 1 week. Although also we are doing resource mobilization. Appeal is out looking for money. How are we going to respond? So it is a joint intervention between African CDC, IFRC, WHO, World Food Program. So, and also I think it's also MSI is also part of the engagement. And then also, we are having UNICEF. UNICEF also is a very key stakeholder. So, and also the structure is the same, pillar based, say that partners will be working on the pillar. So IFRC will majorly focus on community engagement. That engagement at the community level will be the work of IFRC. Risk communication, addressing any rumors will be the role of IFRC. And then also issues of infection prevention, WASH. So also that will be the work of IFRC. So it's still in the initial stages, because we haven't IFRC. The program is around 600 million, but up to now, I think CDC indicated they have around 50 million. So it's still a long way in terms of resource mobilization. But in terms of the response, the Red Cross, especially in DRC, is responding. It's in the community at the community level. For the others, just on high alert in terms of in case of any suspected infection, they are ready to respond. Thank you.
So what can we attribute to the COVID experience regarding how these partnerships have grown, multi-organizational partnerships? So what can you attribute to COVID, what IFRC did with its partners that we think we are now potentially reaping the benefits stemming from that active engagement and involvement?
Yes. Now, one thing which I think building from COVID, because also it was an emergency response program, but it has continued even beyond, because COVID is no longer pandemic at the moment, so it has grown beyond even the normal pandemic response. So what we can attribute is majorly the good working relationship with the other partners, because in the NGO, if depends on how you reposition yourself. If you have good working relationship with other partners, it's very easier to be invited in case of the next response. So that has been very good. Say that you see, for us through COVID-19, we have gotten, we have the Saving Lives program, which is COVID-19. We have the CAW program, and then now we're having the MPOX program. So working with, and you find the partners are almost the same. There are some who are under COVID-19, but due to compliance issues, they were dropped by MasterCard Foundation. So ensuring also you have very good systems which can account for the donor money is very key. So those are majorly the key lessons in terms of ensuring that you build your brand as you continue engaging with other partners. And also that is in terms of the capacity. I think COVID-19 gave us an opportunity to expand our capacity, which is now in need in terms of risk communications. Remember, starting across 29 countries, especially focusing on risk community and communication and community engagement. It was not there, but we onboarded them during COVID-19. Right now, they are part of the community in terms of the response. So, and that's one thing which also other partners they are looking at. We have at skill set at the moment, we can be utilized at the community level. Thank you.
Yeah, thank you so much. Then where are we with the CHW initiative?
Now, for the CHW initiative, it's also, it came from, if you look at, if you get time, you can look at the African CDC side. There was a declaration by member states in 2017 where, the challenge was elder workers in Africa. There are very few elder workers, and the link between the elder workers and this capacity can be bridged by CAW, community elder workers. So they declared we need to recruit 2 million CAWs in Africa. That is by 2025. So that was the target. It was running from 2020 to 2025, which is a 5-year. Total budget was 2 billion. So they needed to mobilize 2 billion USD. So stemming from that, it means now African CDC engaged partners, and one of the partners is IFRC. So we are having AMREF is part of the CAW. UNICEF also is part of it. So it's a way of how we going to attain the member state declaration that we need 2 million CAWs in Africa. So MasterCard also have the same idea in terms of their focus majorly is on youth employment. So are we going to maybe transition youth into profitable, maybe manageable youth employment process within Africa? So MasterCard decided to fund some of the intervention that is within some countries. So for us, we were given 5 countries: South Sudan, We have in Kenya, Central Africa, Burkina Faso, Nigeria. So those are the countries where we can develop the community health workforce program, and then we can roll out. UNICEF is speaking also other countries, and then AMREF. So at the moment, we have started implementation in South Sudan. So South Sudan started implementation even without MasterCard funding. And for Kenya, currently, they have developed the CAW strategy, which only needs resource mobilization. And MasterCard has come on board, so they are working on the proposal. So proposal also is ready for South Sudan, which means South Sudan is ahead. The others, from last week, we are working on the proposal. And Burkina Faso is somehow advanced because the ministry is the one who has onboarded the CAW. So it is funded by the government, which makes it so easier in terms of running with the process. So it means for Burkina, it will be scale up in terms of you are increasing the number. So in summary, the CAW program still at the just the rollout stage, design and the rollout. So for the ones which have gone ahead, like South Sudan rollout, while the ones which are still following up, they are just designing. And it's the same for, I think for AMREF, I think also they finalized their design in February this year. So basically they might be on the rollout stage at the moment. Thank you.
Yes, my second to last question is how has IFRC's goals, strategies, and vision for Africa, how has it evolved? Probably looking at how the pandemic and the current outbreaks and the current partnerships that you have been able to secure on the continent. So what is the updated vision for Africa at the moment?
Now, I think for terms of our, contexts are different, but in terms of the big picture, in terms of humanitarian assistance, it means it's the same for the IFRC, just focusing on any humanitarian intervention or relief, which furthers the lives of individuals globally. So it's the same. But in terms of context now, in terms of the health emergencies which are coming, it means we adapt to them. So you find the strategies are different, say that folks now is coming on board. So are we going to adapt our strategies in terms of mobilizing IFRC, mobilizing the national societies? And also if you go to other, non-emergency responses also, it means preparing, that is the health workers. Like you'll find maybe trainings on first aid being offered by Red Cross and Red Crescent. So it's almost the same goal, but in terms of strategies of response, they are different. So depending on the context where we are operating, and context here can be also in terms of the country, like what's happening in South Sudan, how are we going to respond? So country to country context, as well as also internal programming strategies are varying, but the key principles under IFRC, they remain the same.
Thank you so much. So any last words for me? What are your last remarks for me?
No, I think for maybe the last one is just building on the lesson learned, which based on the responses which we have been having, is just preparing the continent for future pandemic is very key. And the way I'm looking at it is at the ministry level, because I think that is where we have greater weakness in terms of the ministries. Say that policy-wise, they're having the policies. Operationalizing is where now the challenge. So it's a big challenge, because right now we are rolling out like SLL phase 2, Saving Lives and Livelihood phase 2 program. And we expect, in terms of the design, we are seeing the challenges we were having under phase 1, not yet solved. So it means, and it is at the ministry level, because also transition within the ministry, you are dealing with these people. This year you are dealing with different people. So it creates a challenge. So in case another pandemic comes, it means we are going back to almost what we were starting before. So strengthening capacities at the ministry and specifically at the district level, because that is where they are next to the communities. It's very key. So if they have maybe structures which are okay at the district level, it means it will be easier for us to work. While at the higher level, it means the normal policy engagement will be key. Thank you. I think you are muted.
Wow. Sorry about that. So I said,
Sorry.
thank you very much for speaking to me at this time. I will review what I have. If I need any additional updates, I'm going to reach out to your team members. Thank you very much.
Okay, that's okay. Okay, thank you, and have a nice day. Thank you.